Hi, I thought today I'd try a different video. I've done some videos on self-massage, self-treatment, stretching of various areas and some breathing techniques. Let me try a video now looking at the other side of things that I've been working on, which is the data, the numbers, the analysis that's coming all with COVID-19 and trying to make sense of all of that. And in particular, let me pick up some of the details of the post I made yesterday, which was regard the deaths data from the Office of National Statistics, the ONS data as we call it. And in that post, I talked about the gap in the data. And I want to perhaps in video format talk a little bit about that gap and what that possibly means with regard COVID-19. So I've done a few slides to go with that. So let me just get myself sorted with regard those slides and let's start sharing them on the screen. And so find them there. Okay. And let's start the presentation. So the data I'm looking at is the weekly deaths data, and it's for the week ending 3rd of April 2020. Now in that report, there were 16,387 registered deaths in that week. The data seems quite old because it does take a little while for registrations, the processing registrations to come through. So the data for the 3rd of April was only published yesterday being the 14th of April, but it's the most reliable data because it allows for the backlog in registrations, processing registrations. It allows for deaths in all locations. It collates all sorts of useful information about those deaths. On the news, we hear, okay, specifically about COVID-related deaths, we hear a daily death total from the NHS, but their deaths in hospitals reported on that day. The ONS figures are for all locations of death, not just hospitals, and for all cause of death, not just COVID. So 16,387 was the all cause deaths in the week ending the 3rd of April. Now, in the same ONS statistics, for the same week, there were 3,475 registered COVID-19 deaths. Now, what that means specifically is that on the death paperwork, the death registration paperwork, 3,475 of the 16,387, so therefore about a fifth or thereabouts, or about a fifth of the total deaths had COVID-19 on the death registration documentation. And that's, as I say, it's a more accurate figure than the figures we're getting from the NHS up to that point, the 3rd of April, because this is deaths, be it total deaths or COVID-19 related deaths in all locations, not just hospitals. This data has the advantage that it's not only all locations, but it's probably more reliable data for several reasons, because the daily reported NHS figures are deaths, not just in hospitals, but deaths where there's been a test carried out to prove the patient had or has had COVID-19. Now, in the ONS data, they allow for cases where the clinician, the doctor at death or the point of death, declaring death, can, if they suspect there's COVID-19, i.e. a test hasn't been carried out, but they suspect COVID-19 was present, then that will appear on the death registration document, along with any other cause of death that's noted at the time. So the 3,475 includes deaths where a COVID-19 test was carried out, but also includes deaths where it was suspected. What it therefore doesn't distinguish, because COVID-19 is now a notifiable disease, it has to be put on the death registration certificate if it's present or thought to be present, because it is a notifiable disease. That doesn't mean the patient died of COVID-19. It means they died at least with COVID-19. Obviously, probably a significant portion died of COVID-19 or complications brought about from COVID-19, but there'll be some where, there could have been end-stage cancer and they died because of that, but they happen to have COVID-19. They would also appear in this figure of 3,475. Now, the gap concept that appeared in discussions, I put the discussion on Facebook, but I gather it was also on the media yesterday as well, was looking at, well, how many people die in the UK on an average week 14? In other words, if we look at the week 14, the 14th week since the year started of the last 5 years and average those, well, how many people would typically die on week 14? And this bar here is 10,305, which is the 5-week average of deaths in week 14. Now, there's several pros and cons, or there's several points to make here about how best to do an average. You could do as I described then, that's what the official statistics did. They took the week 14s for the last 5 years, averaged them and said, okay, 10,300 is the average of those. There's another analysis say, well, are we having a bad year for other reasons? So perhaps it's a bad flu year or whatever it might be. So you could take, say, the first 10 weeks of this year and average those deaths and say, well, that's an average for late winter, early spring for this year. And if you do that, that's about 11,400, I think the figure comes out at. So there's a number of variable ways. Well, I'll stick with the 10,305 because that's the average used in the Office of National Statistics data. And the interesting thing is this, that if we assumed that all the COVID deaths, the 3,475, were extra deaths, then if you took an average week, an average week 14 rather, 10,305, imposed on that, or added onto that the 3,475, you would actually get 13,800 deaths. But that's still some way short of the 16,387 that we actually saw in week 14 this year. So the gap, as they're calling it, and let's declutter the slide of the numbers we don't need, is the 13,800, which is the average week 14 plus the COVID deaths that were reported this year, versus actually the number of deaths that we had in total. So we have this gap of about 2,500. So that's 16,387 for the week 14 this year versus an average week 14 plus the COVID-19 deaths that were reported. And so the analysis is, where's this 2,500 coming from? What does this mean? What is that telling us about COVID-19, about data collection? What are the theories? Well, let's just put that there for the comparison. So 3,000, let's call it 3,500. They were the actual registered number of registered deaths where COVID-19 was listed on the registration documentation. And we've got 2,500 additionally to explain. Now, I had four hypotheses, or I have four hypotheses as to where the 2,500 could have come from. And I discussed each of these on the Facebook paper. Now, hypothesis A is there's underreporting of COVID-19 cases. So if this hypothesis is the correct hypothesis, it means 2,500, that 2,500 were all COVID-19 cases, they just weren't recorded. So the test wasn't carried out, or the attending physician didn't indicate or didn't think the patient had COVID-19, so it wasn't listed on the death certification. Now, that is quite a significant scale of underreporting. If 3,500 is the actual reported cases, but we've got 2,500 adrift that could be COVID cases, we're underreporting sort of 2/3. You know, if 3,500 versus 2,500, that's a big scale of underreporting. So when I was documenting this yesterday morning, I thought that can't be, we can't be, that's a significant underreporting of COVID-19. What was interesting then was a number of discussions I had with people following the post. And actually, and I think this came up in the news, this was a big item in the news, and I see it's being followed today as well with regard statements about testing in care homes, is that actually there is, or certainly by week 14, which is the data we're talking about here, there was felt to be significant underreporting of COVID-19 cases in care homes. Now, just to give you contrast, in that week, I didn't write the number down, I think 195 care home deaths that were registered as COVID-19 deaths. So 195 deaths that happened in care homes in that week, registered in that week, had COVID-19 listed on the documentation. There were, however, over 1,000 more care home deaths in week 14 than in a typical week. Okay, now I'll have to get the data a little bit differently because the data isn't that accessible from the ONS, but that's an estimate, and it's an estimate based more on the 10-week average of deaths this year so far in care homes, and then looking at the number of deaths in care homes in week 14. And I chose weeks 1 to 10 because in the ONS data, there are no COVID-19 deaths registered. So I took 10 weeks before COVID-19 became a thing. That doesn't mean there weren't COVID-19 deaths in those 10 weeks. It's just that they weren't registered as such. So took an average there, then looked at the number of care home deaths in week 14, and the discrepancy is about 1,000. So if we assume they are extra care home deaths, and probably in the current climate we can strongly suspect they would be COVID-19 cases, those 1,000 plus the 195 that were registered as COVID-19 deaths certainly would go to some way to addressing that 2,500, and certainly probably about half of the 2,500. So that's a significant possibility that a big part of our 2,500 is due to deaths at care homes not being reported as COVID-19. The other big difference in the data was deaths at home. I've got the figures here. Deaths at home, doing a similar analysis, the average over the first 10 weeks of this year, how many people died at home, and then how many died at home, how many registered deaths at home there were in week 14. And that was up by 40%. There were 930 extra of those. So is there similarly another mechanism there that 930 deaths that were at home are not being registered as COVID-19? Now, bear in mind that when I described the data at the beginning, doctors since the 5th of March actually have been able to put COVID-19 on the death certificate if they think COVID-19 was present in the patient, even if a test hasn't been carried out. So the clinicians that are pronouncing death for these home deaths have not been listing COVID-19. Now, it may well be because they think, well, I've not done a test, so I'm not going to put it on the certificate. But of course, there's a subjective, is that the case, is that not the case? But if we assume all those 930 extra home deaths, again, were COVID-19 deaths that were not declared, add those to the care home ones, then we've got probably pretty much 80% of our 2,500 accounted for. I will come to the home deaths in hypothesis D when I get to the fourth hypothesis. So hypothesis A is a big contender, a big likelihood of contributing most to the gap. There's a couple of other hypotheses, or three other hypotheses. The first one is there a change in the registering process? It was just one, as a statistician, I was looking, well, what could have gone wrong? Why could we have got this extra number of deaths in week 14? And I posited, well, was there a bottleneck? Was there a change in the registering process? Could it be that in week 13 there was a delay to registrations, and all of a sudden in week 14 there was a catch-up? So in week 14 there was suddenly a lot of extra deaths registered that would have been registered in week 13 had things been normal. Equally, was there a change in the registration process that meant deaths that in the normal run of things would have appeared in week 15, because perhaps rules had been changed or relaxed with regard to the registration process, they started appearing in week 14? So can you see what I'm suggesting is, was there, comparing to an average year, was there some shifting of registration cases into that week? And there's a little bit of an indication there. Again, somebody contacted me to say from a family experience, there did seem to be a change in the registration process, that some deaths seem to be registered over the phone. Whereas a few years ago, their own personal experience was a registration. It took 6 or 7 days to get an appointment or a slot to perform the registration process. So maybe there's a small contribution there, but that's anecdotal. There's certainly nothing in the media to suggest there's been a big change or a big bottleneck in the registration process. But it was a hypothesis, and it was one that I was going to explore. Hypothesis C is an interesting one. Is it the case, this is the hypothesis, that people who would not normally not have died in week 14, they've got severe acute clinical need, but in a normal week 14, they would have had appropriate treatment in the NHS and would have survived week 14. But in the COVID era, because of the pressures on the NHS system, did they not get access to that care? So therefore they died. So they were extra deaths because of bottlenecks in the NHS, not deaths directly because those patients had COVID-19. It's just that because of the pressure on resources in the health system, they did not obtain the appropriate health care they would have had in other circumstances, other years in week 14. So they died in week 14, whereas in other years they would not have died. Now, if that was the only cause, but of course, because of hypothesis A, we're not looking for a gap of 2,500, we're looking for a gap of a few hundred. Maybe that's happening. I've not heard data, I've not seen data, I've not heard stories, but maybe that is part of the process. If there are bottlenecks in the system, they might be causing extra deaths. So maybe A is the big contributor, C might be contributing maybe a few hundred. So we're getting towards the 2,500. The one yesterday that got me most excited was, are we seeing the signs of a phenomenon that is expected? And that is actually getting more lockdown deaths. The stress, the trauma of being isolated, not having access to normal social contact, social normal routine, because of problems getting medications, whatever it might be, are we seeing a change in the metabolic health or the mental health of the population, which are now causing more deaths, which might call lockdown deaths? Now, again, I think it was very unlikely. I thought it was very unlikely. I still think it's very unlikely that by week 14, we got 2,500 of them. But what was interesting was that, of course, I mentioned earlier, there were 930 extra home deaths in week 14 compared to a typical week 14. Now, yes, okay, hypothesis A tells me they could be just because they weren't classified as COVID-19 and perhaps they should have been. But here's another hypothesis, and normally something like a quarter of all deaths do occur at home. Because of the lockdown effect, there are more of those deaths. Is it because people, because of the stress and worry, who have heart attacks and die at home overnight in their sleep? More of those are happening because of the stress and worry of lockdown. Being quite trivial about it, but nonetheless contributory, a lot of home deaths are because people do things like fall off ladders because they're doing DIY. Well, of course, because we're all at home in lockdown, are there more of those? Again, we can't be, I wouldn't dare to suggest they're giving a big proportion of the 2,500, but they may well be contributory. So that was my hypothesis D. Are we beginning to see some increase in deaths because of lockdown? They're not COVID-19, they're because of lockdown. So they were my 4 hypotheses. As I say, the following discussions after the post very much centered things on hypothesis A as being the big contributor, but I think maybe there's a little bit of contribution from the other 3. What we don't have, or what I don't have certainly at the moment, is data to look at to give some sense of the scale of the other 3, but I think there's probably going to be some contribution from those. So there we go. That was my analysis of, and let's just turn that off. That was my analysis of the gap that appeared in the ONS data yesterday. That's hopefully put some meaning into the post that I put up yesterday, because it's me talking and I'm able to talk through the numbers and give all the nuances with that. So let's hope that was useful. I'm going to post this on my YouTube channel. So if you're interested in more, subscribe to the channel. Also have a look at my website. I've got various websites, massagehealth.co.uk or cuttingcarbs.co.uk. Both those websites are where I'm relatively active, and you might see more information appearing over the coming days. So hopefully I will see you again soon. Thank you.